morning. And we're going to start, Lori is going to give us a broad overview of what person-centered planning is. And then we're going to divide out and move to some other rooms with your programs to help talk about how you're going to create in your program what a person-centered plan is. So we will give you some questions and things to do with all of that. But before we start, I just want to check. Janessa, do you have anything with gold medals we need to know about?
Good afternoon, everybody. Oh my gosh. Good afternoon, everybody. Yay, we got to make this fun because, goodness gracious, we all know this is not, anyway. We were going to actually look at giving gold medals to like either the program first. We're still looking into some of like who's the first program to finish like trainings and stuff. But you guys are so daggone awesome that most of you are done with your trainings on Power DMS. Ridiculously awesome. So we're still going to go back and try and figure out what program did it first and give them a gold medal and stuff. But anyway, I wanted to give you a shout out because that's a lot of work and I know it, and so I want to acknowledge thank you for doing those quickly. Now I'm going to quickly, we're talking about person-centered planning as we're trying to do this. First I want to give you a definition, okay? Well, first I want to back up because we have to have a policy for everything for CARF. So this is a policy that's going through. It is very close to being signed. As soon as it is signed, it'll come to you and you're going to acknowledge, that sign-off thing in Power DMS. But you do all of this. This is not going to be anything new for you. It is more of a semantics of, well, I'll tell you that in a minute. All right, so definition. Person-centered planning is a collaborative, individualized process that places the person at the core of decision-making. It respects their autonomy, cultural background, and unique circumstances while fostering self-determination and community engagement. The reason why I say that we're doing this already is because, I should have questioned and said, does anybody know our values at Columbus Public Health? And people would be like, no, I don't know. Anyway, they're blurry because our laptop isn't working well with the projector. But these are the CPH values. And the two red ones, so we got innovation, customer focus, accountability, research and science-based, equity and fairness. For the most part, person-centered planning is literally customer focus. You've been doing this for years, but they want to call it person-centered planning. So we're just gonna make sure that term, you're not gonna get dinged by CARF if you use client-focused. But we can start changing that. It's a person-centered planning, that'd be great, okay? The other part of person-centered planning, there's an equity and fairness component, and we already do that. So a lot of this is just, you do it. So in this policy, there's a section that says, what are the principles? We need to make sure that the individual is the focus. That's easy to do. And some of this stuff, Tammy's saying, you're going to practice how this actually applies to you because it's not the same in each of your programs because you do something different. But the individual's a focus. It is a strength-based approach on what are their strengths as opposed to what are your weaknesses. It wants you to look at those strengths, utilize them to bring the not so much strengths. It's an opportunity for improvement. It has to be understandable and clear. If you need interpreter, if you need all those you need to make sure it's in the language they can understand. Don't use highfalutin words, Inclusion and respect. Collaboration. Everything you're going to do is in collaboration. Give them decisions. Give them ways to collaborate with you in determining what that plan is. How are you going to help them? How do you want helped? Some of that is their decision. It's flexible and adaptable. So if something changes in their life, you're already going to update their plan. That's flexible and adaptable, okay? And then self-determination. How are you going to make that person be able to do some of this on your own? Some of you are trying to teach them how to fish as opposed to just, here, this is how I'm going to give you a fish. And so that's that self-determination. You're going to give them the ability to do these skills that you've taught them. Next is these In your big policy that people have been writing, and you haven't seen them all yet, there are sections, and that's some of the stuff you'll be working on today. Everyone has an initiation of that planning process. When do you first see them? When does this whole thing start? Okay? Discovery and assessment. What's your, there's screening, there's assessment, there's all these different pieces in it. Where can you incorporate person-centered planning throughout that? Plan development. We've got treatment plans in one section, and we've got care service plans in another, because not everybody can say you're treating people. So you got two different kinds of plans. And then implementation. How are you implementing that person-centered plan all the way through the time that you see them? How are you reviewing that and updating it? Because it's like, okay, if I see you once at the beginning, make the plan, and I never do anything with it and review it and update it at the end, did you really give them an opportunity to make a change? Something may have changed in their life, and say, let's review it. Is this still relevant for you? Okay, well, let's change it. And then training and support for you guys. That's today. This is one of those trainings that we're going to count for CARF. We're going to have to kind of do this regularly. And it may be, I don't think this one's annual. This may be every other year, who knows? But we're going to figure that, and you'll get another one of these in the future. Now it's Tammy. Yeah.
Now it's your turn. So what we are going to do is take the next 30 minutes, spread out into some empty rooms that will tell you what's open, or go into Cantina, or you can do it here in this room. And we're going to do it by program, because as Lori said, some programs it's really easy to know what the person-centered plan is. Treatment, I know we have individual treatment plans. That's a person-centered plan. But there are also other programs that you might be at a 911 call center and you get a phone call. You still do a plan with a client, but it may be called something different and it's going to look different. So we want you all to have a chance. I'm looking at some prevention staff. They don't have that plan, but they do it in different ways. So we need each program to kind of get together. Your program manager will help facilitate this discussion. Do we have paper here somewhere? Still?
It's coming.
Okay, there's paper coming with some marks. Oh, it's in the back. We want you to take one. Someone needs to be the scribe for your group, and someone's going to come back to us and report out so that we can all learn about each other's plans and how they all look different. So all of your managers will have a person-centered planning document that has the kind of things that Lori was going over. When during initiation do you person-centered plan? If a person calls you on the phone or they walk up to your front desk, what are you doing to ask their preferences? During planning of their service, what are you doing with them to see who they want included with you or who's going to be involved? All those kind of things. And then here's just some guiding things for you to think about in your own programs. How can you remove barriers from the person that's seeking the services? How do you capture what the individual wants or their family wants if they're involved? Some of your programs may have family involvement just because of what you're doing in a crisis or something else, and other ones you only see a client, but we need to be asking the client who they'd like to have involved with them for supports. How are you helping the person serve to identify and develop their natural supports and community connections? What strengths do they have? And all of us work from a strengths-based approach, so this should be easy kind of conversation of what you've been doing. So we're going to do that for about, half an hour or so, and then come back in and we'll just report out on how you think you're going to have this person-centered planning throughout all of this service that you're providing. Everybody good with that? Okay, so we have the rooms, the Old Health Commissioner's office. There are 3 rooms open over there if you want to take a team there. There is in NSS 207 is open. And like I said, there's also the Cantina, or you can stay in this room as well. So go ahead and do that. I don't know what time it is now. All right, so if you would come back about at like 1:50, and we'll kind of wander through rooms if you have questions, and we're going to give you the documents.